I just knocked on the door. I closed the door to provide privacy. I performed hand hygiene. Introduced myself to Ted. Ted, my name is R.N. Hayes. After I introduce myself, if somebody's in the room with Ted, I would do my HIPAA procedure, meaning I would ask Ted, is it okay, Ted, that this person in the room can receive personal information about you? Ted would either tell me yes or no. If Ted said no, the person would have to leave the room. I explained to the person that this is his personal privacy, this is his right. We'll be done in a few minutes. We'll call you when we're done. Next thing we would do is I would list the equipment or make sure Ted sees the equipment I'm using. I'll do a quick check over and make sure it's clean. And then next thing I would do is I explain to Ted that we're going to do a musculoskeletal examination. Next thing I would do is I would do an inspection. Inspection basically starts as soon as you walk into the room. You're looking at the person, you're taking assessments, you're looking at the symmetry of the body, you're comparing, see if there's any swelling of the masses, and as you get closer, you're still doing that. You're constantly assessing, you're constantly doing an inspection. Inspection never stops. It's just part of what you do, but that's what we're doing. So I'm looking for, like I said before, I'm comparing symmetry. See if his arms are, seeing this look like legs, and see if it's symmetry along his line. Okay, and then once again, I like I said, I'll be checking for swelling, masses, or any deformities. Next I would do is I do a palpitation of the skin's muscles and any bony articulations at the joints. So I'll be checking for temperature. I'll be checking for tenderness or any masses as I palpate. And then after I do that, my next thing I would do is I would do his range of motion. Now, I start the range of motion with his head. I'd ask Ted, can he move his head left to right? So, rotation. I check to see if it's jaw, pronation, can pronation and retraction. Meaning, can it go out and come back? Next thing I would do is I would do his shoulders for elevation and depression. I would do his arms for flexion and extension. So flexion and extension. Then I do the other one, flexion and extension. Then I do his arms for abduction, adduction. So after I do that, the next I ask him to do, I might ask him to hold ball, I might not. But I do circumduction. Then we do the other arm circumduction. Then I would do his hands. Okay, think of this way, his hands are like this, where his hands are in pronation and supination. Pronation, supination. Then I might ask him to do it a couple of times for reflexes. Tell him stop, we good with that. As far as his hips, I would take a look at that on inspection on standing. Then I would work down to his knees. Well, I do the same process. Then I would take a look at his feet, where he would do eversion, inversion. So this is his feet, not necessarily his legs. Eversion, inversion, eversion, inversion. Okay. Then while I'm doing all of this, I'm checking to see if he's having any pain or tenderness for range of motion. Now, everything we just did, I'm assuming the patient can do it on their own. Now, for passive range of motion, I would assist the patient. So for circumduction, I would see how far they can move it with me helping them. Now, as soon as they get to a point to where they say they're getting pain, that's why I would note limitation and stop. For any part of the body that I'm doing assistance with. As soon as we get to the point of they starting to say they can't, and that's where we stop. Okay. Now, what would we do as far as muscles? I would, so if we had his arm, I would apply a resistance to his arm as if I asked him to lift it to test for muscles. I would do the same for the rest of the body. So if I did his legs, I ask him, I put resistance against the leg to test the muscle. Now, As far as subjective can be done before, during, and after. Where I would ask the patient, states of any joint pain, stiffness, swelling, limitations, as I just said before, muscle pain or weakness, no history of any bone or trauma or deformities, able to manage all daily tasks or ADLs. Can you eat? Can you stand? Are you having any issues, any changes since we last met? Occupational risks. And also, what type of exercise are you exercising 5 times a day? So that's what I would be asking them as for subjective questions I would ask. Because these would be the same types of questions I would put on my documentation, but I would ask this over the course of the examination. It doesn't have to be at the beginning. It can be beginning, middle, or end. So objective, I'm checking for joints, muscle symmetry, no swelling, masses, deformity, no normal spinal curvature, no tenderness to the palpitations, joints, mass, or full range of motion. At this point, I would have the patient stand. And what I'd be checking for is his straightness of his spine. So I'm checking for such things as kyphosis, where a curvature of the spine, lordosis, or progressive lordosis, where a pregnant woman, would that be normal for her? Or scoliosis, usually you might find in young girls after I told them to stand. At this point, after I have the patient sit down, I would ask them, do you have any questions at this point? If not, if they do not have any questions, I would do health promotion. I would ask them, are they eating the rainbow? Meaning, are they eating various fruits, such as, not fruits and vegetables, yes, fruits and vegetables that are green, red, orange, yellow, or purple in color to get a various food group in your diet. I also say, are you getting enough vitamin D? Also, I would say drink no more than 1 drink for a woman, standard drink, and no more 2 standard drinks for a male. Also, I'd ask them to see about a bone density for all women over the age of 65 and for men over the age of 70. Then I would ask them, do you have any more questions? If they do not, then this would be the end of the examination.